So first of all, congratulations, Dr. Shabbir, for passing MRCPCH clinical.
Thank you very much, and congratulations to you as well. And my other fellow who was preparing with me, I'm very happy to hear about him also, Dr. Gerald, who has got through the exam also. Uh,
Yeah, Alhamdulillah,
and
both of you.
I'm really thankful to you for helping us preparing and uh, so much efforts until the end. And especially when in between I was uh, going to like lose, I thought that maybe it will not be getting through. So still you were pushing to practice. So that is, I think, the the key for getting through was the thing actually.
Yeah, I mean, I told you, inshallah, you will pass. But of course, I mean, there are things you cannot predict, right? So you need to keep a positive, ummeed from God that He will, pass you, and try your best. So I was a bit tough with you guys, maybe, but there is always a reason. I know. I mean, the exam is actually easy, but you need to practice for that. That's why I was, you have to practice. You have to practice. I keep on saying this. Yeah. Okay, so let's start with your stations.
Yeah. Uh, Stations. I'll just open the this feedback. Also, did I send you the feedback?
Yeah, I have the feedback here. But you can just tell us the cases and then we can, if somebody has any questions, then we can go get back to the PDF if needed. Mainly, they want to know about the cases and details. People do post about it, but I mean, what you will say is a different way. It will be more in detail what cases came, right?
Yeah. Uh, so to start with, actually, my cases started with the short case. Uh, so first one was the uh, case with the uh, TNS actually. That was as per feedback. It is a hemiplegic CP. This is the case in which I've got only 2 marks. Uh, this one was a grown up child, about 10 or 11 years old, and the command was this child has difficulty in walking. So guided by the mentors, so you have to like whatever the commands you have to go by that and check into that one. So I asked him to walk, but basically he was some mental his mentality was also like uh, low, rather significantly low. So when I asked him to walk straight, he seemed to me like a little clumsy actually. Uh, then I asked him again, and I felt he is little swaying to one side, little bit more, but both sides he was going to this one. So I took a little more time in assessing his gait, but I couldn't pick his hemiplegic gait. The arms, there was no specific posturing of the arms actually. If you that is usually when we pick up the hemiplegia. So then after that, taking to the couch, I asked him to lie down, and when I checked his reflexes, tone was normal. Little difference of calves was there, but it was not very significant. And the reflexes were brisk bilaterally. Then after that, uh, in this only the time was going to finish actually. So I just checked his clonus, but I missed the planters, which has been mentioned by the examiner. So then I made it. I told that this is probably a diplegic CP because of the mentality and bilateral reflexes are brisk and tone is increased. Then I told him that the gait actually. to me it is little clumsy, so I cannot make out that. But maybe little swaying to one side was more. So I need more time and more full examination of the upper arms to make it either hemiplegic or the other like this one. So he said,
Okay, so, I mean,
so
your opening statement was to do the lower limb examination, or did they only
yeah,
said,
the opening statement was that this child has some difficulty in walking. Do the
hmm.
motor examination of lower limbs.
Oh, okay. So they didn't say do motor examination. They said of lower limb specifically.
Yeah.
Oh, okay.
So
That
then
is
I
actually
then
not correct. I mean, if it's a hemiplegia, they should tell you to do the full motor examination because you need to also diagnose the upper limb, isn't it?
yeah. But basically there will be time also will be less. So it is hard to
Well,
finish
the
all.
time is enough. You just have to practice enough to be that fast. But the thing is that you have to do the upper limb. How else will you diagnose hemiplegia, right?
Yeah. Yeah.
Whenever
Upper
that
limb,
doesn't
I think it's must to say this
Yeah,
it's
it is
hemiplegic.
must. This is what I'm asking. That's the reason I'm asking you. He say lower limb? If he said lower limb, that is actually not exactly the correct opening statement for hemiplegia.
That is what I after reading the feedback after the result and feedback only I came to know that I'm sure that it was the hemiplegic. Uh, Before that, still I was thinking, as you said, that after coming back from the exam, you mark your marks. So I marked the three different types very tight, especially the one because this is the fourth time I had gone for the exam, and some of the examiners I know them now very well. What kind of examiners are those? They are very tough. So I didn't expect even one of the examiner who was for me this and in development station. Previously, also I had gone to her twice, and she had given me one mark, once development, once in neuro. So this time also I marked very tight for her. So in this way, actually, my
Yeah, you
marks
can't
are
predict it.
coming.
No, actually, the examiners are not actually always bad. Maybe there was something that she thought you didn't do, and that's why she got the marks. But usually, I mean, most of my candidates they don't get that low marks unless the examiner is very nasty. Most of the because I've trained you this way that I mean, you'll cover the main things at least. So I wasn't expecting you to lose marks in development, but yeah, the clinicals are always tricky. No matter how much you are sure about it, sometimes it's completely different.
Yeah,
Anyhow, it
this
doesn't.
so for this neuro, actually the least I marked for myself was 4 marks because I missed the planters. Uh,
Mm.
so, but they have given me 2 marks. And anyway, so let's go forward after this one.
Yeah, so this
So
was the first clinical. Second.
yeah, so here in neuro, some of the stations there were two examiners. One newer examiner and other one was like senior examiner. This neuro
Okay,
was
so
one of those. I
mm.
have seen this person before. Once I took one patient escort from here to Royal Hospital, and he's a respiratory specialist. So he was in neuro, like the he was examining, but he was a new examiner. The senior examiner was sitting there. Anyway, so this one after that, the next case was respiratory.
Yeah, go ahead.
So respiratory case, that was a chronic suppurative lung disease, a grown-up child with the pectus carinatum kind of deformity. Here also two examiners, one senior and one junior. The senior was just standing and observing all this. After the commands, he just told me that this child has. I don't remember exactly the command, but this asked to check to examine respiratory. So I started with the card, counting the respiratory rate and looking for the distress. So then she just immediately she told me the respiratory rate 40, so that we should not waste the time and move ahead. So sometimes the examiners are, when you feel they are helping, they want to finish the examination in due time. So they will be helping like that. But it depends. Some will just keep quiet and observe what you're doing, but some will be like that. So she told me, and then after that, once I started examining uh, here, when examining in the front, the while palpating, I just told that I will do vocal resonance rather than vocal fermentation. So I will omit with this one, and then after finishing front, then I went to back, and I asked all the in front, then back. So this just after that, she just told me when I started telling that child looks to be malnourished. He has obviously clubbed. So, so when I told that he's obviously clubbed with the grade 4 of clubbing, and then just I when I was telling, so just she interrupted and asked me the other positive findings only. So there were bilaterally there was a practice carinatum kind of chest deformity. He was malnourished, and there was clubbing, and he was uh, respiratory rate 40, as they had told, and there was bilateral crepitation more on the left side. After that, the discussion was just as usual for the for cystic fibrosis. So they asked about it. So here, full marks, alhamdulillah, 8 by 8. Then the
Okay.
next,
So yeah.
yeah. So just they asked about cystic fibrosis. What are the like what the investigation will you do? So I told that I will go through the previous record, and I will check the further investigation. I will see if HRCT is done already, and then management quickly. Like there are 3 minutes only, so 1 minute each. So important investigation only, as you had told. So for most important investigation, you have to tell before rather than telling CPC this and that. So like that only. I just told if they ask, then further into that. So after that, the management investigation. So investigation, admission, at admission, blood culture will take and start with the antibiotics, and uh, depending upon the previous culture, we'll see if there was last culture. So accordingly, I will choose the antibiotics, and we can tailor and we'll do the sputum culture also, etc. So after that, the next case was this one, cardiovascular. Cardiovascular. Uh, Actually, it was the so VSD, what a well-grown child, 8 years or 8 or 9 years old, and there was a murmur. So this the file was on just on that one VSD simple case, and the examiner because I think he remembered me, so he told you will get through this time, inshallah. At the end of the
Okay.
paper.
That's
So
nice.
then the next case was abdomen. Abdomen was 11 years old girl. She was pubertal actually, but as you know, so I just told that she looks to be pubertal. I would like to examine her. The command was like she has been admitted with uh, some transfusion or something was like that. I don't remember exactly the command now, but anyway, that was a case of
Yeah. Sometimes they say
chemo.
regular transfusions or something like that. History of
Yeah.
regular transfusions. Okay.
So she told there was a big spleen. It was about
Oh, okay.
8 9 centimeter.
Hmm.
Liver was just palpable only, and
Hmm.
otherwise she was not pale at that moment on that day, and he was pubertal. So while just examining, I told that this is she looked to be pubertal, and I should do her this one assessment. I said okay, just to do the abdominal examination. So when I felt the spleen, uh, to measure the spleen, actually, I was not like we are not doing in the clinic uh, the measurement with the tape measure. But I just saw that one tape was lying on the foot end. So
Hmm.
clicked it, it clicked. So it's just I took it and I measured. Then I told them it is
Yeah, I told
8
you
or
guys
9.
always measure with the measuring tape, not with the fingers. And before you start the palpation, you should ask for the measuring tape.
Yes,
So
sure, ma'am. That's correct. But basically, in the exam situation, sometimes your the reflexes
reflexes,
will
yeah.
when there is stressful this one environment, and sometimes you go back to the your
Mm.
uh, this one
Habits.
reflexes only. What you are doing more commonly, that will come again. So
Yeah.
as in the clinic, we are not doing this so commonly. That's why I think. But anyway, I that also the like my senses still were not that much now.
I
That
think
not, not,
you
not
are under stress basically. I mean, it is stressful, especially if you're going for the exam another time. Then it's always stressful. So I think maybe that was at the back of your mind. Maybe I think.
I think it for this time actually the exam was not as much stressful as it used to be before, because the last year especially I was going for the exam with a gap of 1 year. So when I was preparing, I didn't do a proper course. I was preparing with someone, my senior, although she was helping me. And whenever, rather, she was also asking me whenever I was free, I can do anything what I want. But uh, in the beginning, I had, alhamdulillah, my kids also. So, like just 1.5 months before the exam. So, and she
Yeah, it's
told, if you
difficult.
can withdraw, she told me that if you can withdraw, so you try better to withdraw. So that also was in my mind. So I was a bit depressed from that, but I didn't withdraw. I went for the exam. And last year, my developmental station in between this co-examiner, just in the middle of the station, entered, and then she was interfering more, and that was the station where I lost actually. Otherwise,
Mm.
maybe I would have got that time only. So this time, because we practiced, and you had been pushing me most of the time, and especially here there was no, we were a very small group, and there was no way to escape. So I had to do anything, something on each and every meeting. So um, my communication, I knew that my communication part is weak and development is weak. As always, I was telling that these two are weak. Clinical, I think I have sufficient exam methodology is good. It's okay for me, but and discussion part, we were discussing in the videos. Almost always we have discussed so many cases, we have discussed it during the videos only. So that was revising our knowledge also.
Yeah.
So so Alhamdulillah. Then this abdominal case, this the discussion, basically when we were discussing during our uh, preparation. So from there also you get tuned up when you prepare, that how the examiner will ask the question, and when examiner is trying to drag you to some specific thing. So immediately you should pick that what kind of answer they want. So here the spleen was big, and she was a grown up girl, and spleen was quite big. But here, then I told this could be sickle cell, because last year also one boy was sickle cell, but because of spleen, I thought it should be atosplenomesis and should not be there. So then I gave other diagnosis. But when I got the feedback, then they had written that is sickle cell. So here it's more commoner also. The quite bigger children, they have spleen when they are sickle cell anemia. So that was
Yeah,
sickle cell
exactly.
disease.
Actually, one of my mentors, he was in Oman. Although, I mean, when he was teaching us, he was in the UK, but he used to tell us that in Oman there are lots of sickle cell anemias with spleen. Don't think that there it would be completely gone. So yeah, but it's like 8 centimeters. You were saying it's a very large spleen.
Yeah.
Mm.
So sickle cell anemia, then other differentiator, this could be sickle thalassemia, and that's one. Then the this one portal hypertension. So then just they took about they asked about the management investigation about the sickle cell only. So and then it's
Mm.
finished. Then comes the developmental station. So this is the one. Actually, here I should praise Dr. Mohamdi especially because I knew that my development was weak. I told her before that I want to practice it more whenever you are getting time. But most important is the day, one day before the exam, uh, that night when I traveled to Muscat. So and somewhere I lost. The plan was to do one or two station at the development, especially you will do again at 10, but 10 Oman time, rather 9 Oman time. But I was not able to reach the hotel, and there uh, it was about 1 hour uh, late. So just I got into and got the message from Dr. Mohamdi that we can do. Otherwise, in between, when I got the message, voice message, I gave him as message that I'm getting late, so maybe will not be able to do. So I thought I will not do today. But when after that I got, so then I felt she wants to do, so I should do. So this is, and we revised the case. The same case came the next day. Additionally, I had already some kind of, you can say, belief that whenever doctor previously when I got I had one mock uh, previously with Dr. Hamdi. So that time I felt like she has some feeling or somehow sixth sense, whatever you say, that what cases are coming, she will practice those cases. Two cases from that mock that time came. So this time also, I think we had done the communication. So many communications done. Those came this the clinical stations and development also. So development we did the same night. Uh, this and almost the same came in the morning. This was a 1.5 year old girl, which was the history was like she had recurrent seizures. So in the history that the mother explained how that happened. So that was a typical of infantile spasms, and then in between she took for the investigation, seen by the neurologist, seen by admitted and investigated, and then started on medicine. Then after that she had the seizures were stopped, and the medication also she stopped in between. Then again child was having seizures, and then this type the seizures are different. So I made the diagnosis of infantile spasms. But there was no this one tubers or no other any features of tuberous sclerosis or any other neurocutaneous syndrome. But the examiner. Then after that, I had to give the motor assessment. So gross motor, I asked them the examiners, and she first of all they will tell you to take the toys, whatever the toys you will select. So there you have to, according to the age, you have to select a couple, as was told by Dr. Hamdi during our preparation, one appropriate to the age or even little above also you can, but to tell them that I will see maybe the child will be able to do with this or not, although it is not appropriate for the age of the patient. Or in the history, if there is already one assessment is done, that is it a global development delay or it is this one the single development delay only. They told me to select the toys. I took some things that I will check this. So then after that she started asking me, then like I asked this one that I will see this, I will check this, I will see this. So then she asked me what is the age. So that I told her it was about 6 months. Uh, the Basically when the range is told, so I told it could be uh, uh, 3 to 6 months, or 6 to 9 months. I told her. She said 6 to 9 months. Uh, So then I said it is most of the things are about six months actually. So just for the sake of the range in between, I just told. So I said okay. like mouthing was there and all those things were there. So that I have got 10 marks from a well-known tough examiner. Alhamdulillah, 10 out of 12.
Yeah, Alhamdulillah. So
Yeah,
basically,
and
if
that
you
is, I
answer
think,
the
that
questions,
that is
yeah,
probably because we revised it the last night. Otherwise, I think I would have maybe it would have been difficult for me to, because development is now commonly we are not doing in our clinics and not doing so much of this one. Even during
yeah,
preparation
development
also.
actually seems hard, but it isn't hard once you get the hang of it. I keep on saying that anything can be hard if you don't know how to do it. But once you do it properly, I mean, once you practice it, it's actually quite easy.
Yeah.
But of course, your
So
examiner and role player also have to be good. It's your luck.
basically,
Sometimes you get.
basically because when I entered the exam in this station, uh, last year I requested the chief examiner that I don't want this examiner. The previous year, because she had given me 1 mark only in development and then neurology. So this time I didn't ask them. Although the chief examiner one was the same, another one there were two chief examiners, other one was different. But I thought that's okay. I'll go. And when I saw her again in the development station, once it's like shocked me. But then I gathered myself and I thought, okay, we'll see. So, alhamdulillah, it went well. Uh, in the differential, she was asking me actually something she was uh, different she was expecting, but until now I couldn't get what she wanted actually. I told her that it could be tuberous sclerosis, but there is no this. She
It's
went
written
as far.
there. She wanted you to mention metabolic disease.
Uh,
Her
so
writing
maybe
is
that's.
very, very faint. I can barely read it. Missed differentials of metabolic disease. There's something else she's written below. I can't read that. Missed something else. I can't read it. It's very light, her handwriting comment there.
Yeah, this is like this is with the pencils. This is a problem. Actually, the last time I wrote to the college also, but they don't bother it much. So
No, I
at
think
least they.
one is that it's not only the pencil, but should be legible. Some of them write in such a handwriting you cannot even read it.
Yeah,
I'm pretty
that's
good
actually.
at reading it, but even then, sometimes there is I do come across handwriting which I cannot read at all. In this case, it's quite faint. If it had been darker,
Yeah, but Abdullah, at least he has marked good. Then despite
yeah.
this, because previously she was known to me that if you
So
don't
I
tell
mean, we
something
can
specific.
learn from this. Yeah, we can learn from this that it's not. Some examiners are horrible. I agree with you, but they could be. I mean, always cutting down marks, but it's not always like that. If you perform well, and you think maybe the examiner was bad, but you should not get scared if you see
This
an
is what
examiner.
very very important thing is this in this case actually. Once I was on entering, once I felt like it's like it will be difficult. Then I gathered myself and I thought we'll see. Inshallah, it will be okay. So yourself, as you say that talk to yourself in a positive manner. So there that thing worked. So this time I was more confident. I behaved confidently. That was also a key in this station. I kept my voice little louder so that
Mm,
she can hear easily. Because in the beginning, when she asked, I felt like uh, she couldn't hear. She asked again from while selecting the toys. So then after that, I kept my voice louder. So that gives you like uh, an impression to the examiner of confidence, and that also matters.
Yeah,
Uh,
confidence really matters. It's like a major aspect. Sometimes people say the correct, differential, and they sound like unsure. So the examiner gets a chance to, some of them say, "Are you sure?" And then you start getting more confused, like that kind of thing. So you should always say it confidently, even if you're not sure. Maybe you're right, then tukka lag jayega.
yeah,
That. Yeah. So always be confident, but not overconfident. Of course, there is a limit. If the examiner is trying to, you know, say, "Are you sure?" Maybe he is actually helping you think of something else. That could also be the thing. They're both things. It could be prompting for another differential, and it could also be testing your confidence.
Yeah, but this examiner, she doesn't give much hint, or she just is, and she's no expression also. Most of the examiner, you will not get the expressions that they are, you are doing well or
Yeah.
good or whatever, because they are continuously examining one over the other, and they may be tired also. My exam was evening this time, so they already have done so many, so they will be in between tired also. So I think that is that
No,
also
no,
matters
actually,
there.
this is actually a mature examiner who doesn't give you a, expression. It's kind of very disconcerting because I had all mature examiners myself in my exam, and I was feeling frustrated because there was no expression. I felt like I was talking to the wall. I mean, you want some sort of, head nod, yes, you're correct or whatever,
Mm.
reassurance, but it's even in the local exam in Pakistan, my first station, I was completely, put off. She was not saying anything or had, just staring at me. In the end, she did a little smile, and then I felt reassured. So it's really scary to have these kind of examiners. I mean, some of they're
Mm.
actually trained to be like that, especially for MRCPCH. That's
Mm.
a good examiner who doesn't show you the expressions, but it's scary. I agree.
Yeah. Alhamdulillah.
Okay.
So development 10 out of 12. It was like myself, and after coming back from the exam, the maximum I marked 10, but the normal I marked 8 for the development actually, because that differential she was asking me repeatedly, but I was not able to tell. So because when I told her the tuberous sclerosis, she said this is the cause, the differentials. Okay, then this much only I know. Uh,
Yeah, I mean, if the child has any, neurodevelopmental problems, they want a really wide range, like all sorts of causes, including infections, trauma, metabolic, everything has to be said, possibilities could be there. But if there's not in the history, obviously, you would prefer to say something which, more likely to, of the 4 or 5 causes that there are. So, I mean, yeah.
mm,
She actually wanted the metabolic cause, I think, because if the
mm,
child has West syndrome, it's probably West syndrome the child's got. So that's one of the causes. It's not just tuberous sclerosis. People just think West syndrome, tuberous sclerosis, right? No, there's so many causes of West syndrome. So we have to think about them as well.
yes, ma'am. So
Okay,
then
so the
next,
history. Yeah.
yeah, next station was the history station. In the history station, the history was the 5 years old child who had mm, this upper respiratory infection, pharyngitis or tonsillitis, and the parents had gone to the GP. Then GP had sent to the our specialist clinic with this concern about his high blood sugars were there in GP clinic, which was it is written this much only. The reading was not there in the outside. Uh, then this one, after taking the history from mother, that was like outside was written the parents are concerned, or parents, like as the parents names were there, so as if both the parents will be inside, but there was mother only. So that's I, after making that repo, I just asked her that where is the husband. She said, "Oh, he's gone with some important work outside." And it's in outside only it was written that the child is now playing in the play area. So uh, I just asked how is he doing, and is that the child, she's well, he's playing there. So then so after starting the history, I asked the mother all the on this one, why are you concerned so much? I felt like, so this was a IVF conception, and mother had concern because her one of her friends mother or someone was having type 2 diabetes, and then renal issues. Another one, uh, her father-in-law was also having diabetes, and so she was concerned because of that. So then here only I asked what was the sugar level there in the GP clinic was 10.9. It was still in the uh, normal higher range. And then the with the here in the specialist clinic, it was they came after. I mean, they got the appointment. They came after 4 or 5 days. So here it was 6.8 only. So I asked if did you check the at home? She said I have glucometer, but I didn't check. I just took child because of that. And there you checked it. So then additionally, uh, this one some uh, asthma was also there, but he didn't need significant this one.
But he didn't
The
need steroid inhalers.
Yeah, there was this was inhaler was there. So only on the salbutamol inhalers. So here when telling to the examiner on discussion, I told that maybe it is related to steroid also. So discussion went like this. I told that this is related to the upper respiratory infection. So maybe that's stress induced this one hyperglycemia, but later on this was normal. Even that reading was also not high enough to take. He said, "What investigation you will do?" So I told, I can check a couple of more readings, fasting and postprandial, and also HbA1c you can check. And management wise, I told this is mainly the reassurance. There is nothing specifically needed. So that went okay, and I got full marks.
Yeah, this came first time in UK with one of my UK candidates, and yeah, it has come before as well. This scenario,
Yeah.
induced hyperglycemia. Okay, so this was the history. Next,
Yeah. Here, one thing actually, I didn't ask much about the specifically polydipsia, polyphagia, weight loss. So that examiner mentioned to me, but still he gave me full marks. Alhamdulillah. He
yeah, thank
mentioned that you
God.
didn't
It's
ask
very
about.
essential
uh,
to rule it out. Yeah,
Yeah,
weight
but
loss and all.
I told that the child is otherwise this sugar level is also not very high, so I don't think that there is something so significant. This is mainly the
No,
mother's concern
as
only.
we're suspecting diabetes, we have to rule out everything under the sun. I mean, all
Mm.
the symptoms and even comorbidities, everything has to be done. So anyhow, that's good.
So
Your examiner was nice.
yeah, alhamdulillah. Yeah, he gave me full marks. I was expecting here also 8 marks actually, but I got
Yeah, we
10.
can never guess. We never can guess what the examiner is gonna give us. It's always
Yeah, basically this
sometimes.
is like sometimes when there is, I think this time it is help from God also, alhamdulillah. Uh,
Yeah,
like where other one of the station which I was thinking that went lower marks, so other on the other place it will be compensated like this one. The history there was has compensated my video station. So the
yeah,
video coming to the video station first station was urticary rash. Child, 11 months old child, or 10 months old child was playing with the mother, like mother is lifting her on her like the shoulders and then down, and he had rash. He was in the diapers only. He had typical articular rash, the wheels, and there was a bottle was lying there. So I thought maybe that's a clue towards that may have this is that feeding bottle. So that is on the formula feed and the cow's milk protein allergy is something they want to ask about that. The examiner, I don't know why he was asking what kind of rash it is. I told this is a typical articulated rash. This is there is a map like appearance, and so then he asked me what differentials. Specifically, he asked me about what the investigation. I said mostly there's no investigation, but if we do, then uh, the CBC will show us eosinophil, high eosinophil count, and uh, further. for the cow's milk protein allergy or something we can do if we are concerned about that. So he said that that is the cause, not the differential. Then he asked me the is it a macular or papular? So I thought maybe he wants to give me a hint here, macular or papular, but this is articular. Again, I said this is articular rash. Then he said, then after he was just looking to me, but here one thing, some uh, unusual happened. This was video station two actually, but I gave him the paper filled for video one, and he also started writing in the beginning. So he was unhappy with that thing. Although it was
Oh,
a mistake for for both of us, uh, he didn't check also. So in between, he said this is. Then he took the other paper and he started filling. When I had just already seen the video. Then I think maybe 30 seconds from the time for discussion. Also, he took in filling that. Sazan is there.
okay. Yeah, so why didn't you say it's maculopapular? They both have macular rash, and it's also raised.
Yeah, basically, in this in the arterial rash, it will not be typical of macules and papules. It is just it will be raised and it will be evenly so
I think we
distributed. This is
don't see
otherwise
that much
called.
urticaria, but if you see urticaria, especially when it's like subsiding and not very severe, it will not always be all raised. Some of it will be macular as well. But I mean, in our countries, we don't see much of allergic reactions that much, right? I don't think you have, right? Seen much of allergic reactions?
No, here we see quite common with the this one. In our clinic, sometimes like with the weather change, as like nowadays, it's this
Mm,
rains are there. I've not seen this time, but after the rainy season or some, they will come with some viral symptoms plus
mm,
arterial rash, and that is very difficult to subside. It will take some days. Sometimes they had been given antihistamine, not responding to antihistamine easily also, but they will take it will take time for 5 days. Sometimes
mm.
they will get the steroid also with that one. So the same thing here I asked, but he what he has written in this one, you told that it is a map-like rash. It was a maculopapular, well demarcated, but still I am sure that it was not a typical that one macular or papular. He said whether it is macular or papular. Anyway, so patchy rash. So then it's additional clinical examination. You told you will look to the uh, diaper
Diaper.
area and mouth, diaper and mouth, and you should look for the CVS and chest because like if there is a one allergy is there, so I should differentiate for the allergic reaction or something. So that I should see. Anyway, he was not happy with that. He has given me 1 mark. Here, I was thinking I will get four at least, but it's one only. So it's okay. Uh, but anyway, it
I
was
think basically this he's going more towards anaphylaxis. That this child may have had some,
no,
anaphylactic
but here,
reaction.
see, this one, the third thing he has written that actually no investigations are required for acute urticaria following viral infection. So viral infection, I told that it could be with some food, it could be with the milk or eggs or whatever, and it could be with some even some insect bite. It could be with the viral infection. So I don't know. But I think he was unhappy because of the thing which has happened in the beginning. So he marked down for that also.
Yeah, I think he just wanted, a simple urticarial management. He didn't want anything stepping up. So why is he saying then you should look for the CVS and chest if he's looking just for urticaria? I don't know. It's
Mm,
written there that features of anaphylaxis you should have ruled out like that, I think.
yeah, should look for CVS, chest, and this and that. So,
I
okay.
mean, it's true. If you have one allergic reaction, you have to look for everything else. But obviously, you need to also look for the whole skin, including the mucous membranes and stuff. So if you said the diaper area, I don't think it's completely wrong.
Yeah, but okay.
It could be some, yeah, it could be some other type of rash as well. So we need to rule it out. And they could have, contact dermatitis in the nappy area. So why not? If the child has urticaria, they might have contact dermatitis as well, right?
Yeah.
Anyhow, this whole thing is that this is actually a new video, so now we have to, based on this feedback, we have to make our,
The videos, I think the videos are basically they are from the pool of local like examiners. This one, local examiner or chief examiner. I don't know if it is if those are sent by the college to them or they tell them that with these videos we have and then accordingly
No,
they
I
can
think
choose
you're
it.
right. It's actually the examiners themselves. They introduce. Sometimes even the communication is introduced by the examiner. I remember there was one. If you remember in Pakistan Center, I think it was the first or second diet that when it was started. It gave a classic communication of Huntington's. If you remember, it came first, and because of a Pakistani examiner. So maybe, I mean, people do put their own videos, and the thing is that nowadays a lot of arthralgia is coming, and it's not very clear what kind of arthralgia is that. That's a big problem. I mean, child is looking completely well and they say it's osteomyelitis. I mean, how can it be osteomyelitis if the child is well looking and he's running around? Seriously, I mean, give
Yeah.
some signs of fever and well looking child and then they make the diagnosis of osteomyelitis. So I find that kind of, tough. Videos are supposed to be easy. One of the stations that I tell you can easily score, but they can get confusing sometimes.
Yeah.
So yeah, I mean, this is a issue that's why you have to really secure all your stations. There's no such thing as ignoring anything because maybe you might need the marks in the other stations if one of them that you think were one of your standard easy stations. You they didn't give you the marks in that, so you should be prepared for the whole exam. There's no such thing as targeting only certain areas only. That's a bad idea.
Yeah. And most important thing is for me actually previously I've always got nearly full marks in videos. But this is first time
Yeah,
I
that's
got
what I'm
only
saying.
one.
It's easy to get full marks, but sometimes these kind of things happen. Either the examiner or the videos confusing as well. So it happens.
Mm. That's
But
okay.
the video one you got full marks, right?
The other one, yeah, that is full marks.
Mm.
I was expecting five from that and four from this one. The which one is 1 mark and the other one was five because that was a herbs policy. All this one because I'm working in neonatology, so that was a bit easier for me. So I told these features are there and. This was the child had come at 5 days of age to the clinic. So here I told I will see for the non-accidental injury also. I think that was the point where the examiner uh, liked it maybe.
And also
Uh,
the therapies I mentioned to you one day before.
yeah, the therapies. When in discussion, I told him the constraint induced therapy, so that he liked actually. I
Mm.
just I could guess the his expression and he commented also something I don't remember exactly, but he told. But one then after that he asked me one question: if child has distress, it develops this
Mm.
distress or tachypnea or distress, so then
Mm.
what do you think? I didn't pick that one. I don't remember exactly, and
Also, I
for
did tell you during
for,
the video that
yeah,
the
for
comorbidities.
quite some time, I have not seen a case with that kind of thing actually.
It's
This
a
the
rare
phrenic nerve.
complication, I think. It's a rare complication,
Yeah,
but
so
it's
that's
trivial.
why I marked myself 1 mark less. I thought he wanted to give me full marks here if I answer this. Because
I
after
think
coming
he
back,
asked you an extra
I
question.
told
No,
you
he was
also.
probably. impressed by you, so he asked you an extra question. And when they ask you extra questions and you don't answer them, then they don't cut marks. Yeah, yeah. This happens.
Yeah, maybe that in the key, maybe it was not there, but he, I think he wanted to just check my knowledge. So, so
Yeah.
alhamdulillah, but anyway, that was that I told I don't know.
And
Mm,
somebody is asking what is the complication. Yeah, somebody can guess what is the complication that happens in Erb's palsy that will cause distress. Any of you?
Phrenic nerve involvement, like
Yes,
extended
exactly.
air palsy, extended.
Yeah, exactly. The diaphragm basically will be affected, right? So that
yeah,
will cause
yeah,
paradoxical movements.
yeah.
And
I told you also, and I told my senior consultant here
mm,
in neurology. So then he
mm,
told, we have told you before that what to see in this one, because when there
mm.
is some instrumental delivery and to look for that, we discussed in the morning meeting. But I don't know, I didn't pick that because we're not seeing the case. Uh,
Yeah, I mean, this is true. If you see a case, you'll never forget it. That's why, I mean, we should go and see as much as syndromes and these things as possible. Not only for the exam, but for as a pediatrician, so that once you see a syndrome, you'll never forget it. Anyhow,
yeah,
so next it was communication, right?
yeah. Communication. Uh, the one communication was a quite a long scenario. 3 and a half months old child, and mother uh, was had started the formula feed because she's working also, and she was some concern about some things. So she has started the formula, and she started weaning food also, additional some food, and that was the thing. And she was concerned about colic as well. So there was multiple things in that case actually. So here uh, part of counseling was there. So from the outside, I judged that this is and that formula was a soya milk formula. So here they want to judge that what age you should give the soya milk and what age you should not give, and the similarly the weaning foods you should what when should you give and when should not be started, and also so I counseled her about breastfeeding and benefits of breastfeeding. I told her that soya milk is not to be given before 6 months, and also only on the advice of the doctor, the pediatrician, not by yourself. And you can still, she said, I don't have enough milk, so I said you can still start. We can arrange for you the breastfeeding department. There is breastfeeding nurse, and they can help you. They can tell you so like that. So that went good actually. And here I have got full marks in this one.
Okay.
Um, and the other case was, as usual, the angry mother. Uh, this has this child was admitted with the urinary tract infection, and he was kept on antibiotic and one of the bay, and they had admitted another patient with the coryzal symptoms, and that has come positive with the RSV, and this child has come positive also. Then they have shifted somewhere, and mother arrives in the morning, and she's very angry, and she's just starting after the immediate after the introduction, she just bombard that why this is kept there and why the child was kept there. And I have observed that the nurses are not doing appropriate this one, and they're not washing the hands. So I said they are using hand gels, and we have always we are emphasizing, and periodically we are taking their this one refresher course kind of thing. But we will look into that one, and we will have already this issue has been raised and in the meeting and with the seniors, etc. Then she was insisting to complain. So finally I told her, okay, we have this patient liaison service, so I can help you for that one. But initially twice I tried to settle it there only, but she was not agreeing. So this one, I think here 1 mark less. uh, This examiner, he knows me, and I am known to him also. He was here in he was in the medical college. He was a professor of pediatrics. I think recently retired. Maybe I've not seen for last couple of years.
He's not
So
written any reason for cutting the marks. Usually they write the reason.
yeah, but yeah, it is not written. This yes,
Yeah,
but
this is
many
another thing.
maybe this is and then the managing concern. Maybe so her concern is not fully managed.
Yeah, we can only guess what is the reason. Because I mean, in the end, she wanted to complain. Obviously, after saying to her that you'll do talk to the nurse and all that stuff. If she's still insisting, obviously we will say we'll guide you. You can't simply dodge her. So I don't think you did anything wrong here. Maybe a bit more empathy or something, an apology. Did you apologize?
Yes, yes.
Okay. I don't know. I mean, we can only guess what is the reason he cut that one mark. Anyhow, just
I
one.
know. I told her that the hand hygiene is really important. Yes, it is. Of course, it's important. We do this before touching the patient, after touching the patient, and all that. When we enter the room, when we are when do any procedure, then also we wash our hands like that, so that examiner will listen to that. And
Yeah.
so, so anyway, it's okay.
Yeah, I mean, basically, the child was not diagnosed at the time, so he only had coryzal symptoms. So, I
Yeah,
mean,
and
we
yeah.
cannot.
Additionally, I told their mother that this is not necessary that because this is a viral infection and it is. It is not necessarily that it will be transmitted through the hands. So even good hand hygiene, whatever, it can be it can spread. It can be transmitted to other through aerosol and so on, the environment.
That's why she's angry, right? Why did you put him with the other kid? So she'll
Yeah,
still be angry despite maybe the nurse didn't give it, but because you put her child with the RSV patient, he got it there. Anyhow, he's,
yeah, that, yeah. In the
yeah.
beginning, this was the reason that why did you keep my child here? But then after
Mm.
this, she was asking about this one. So I guess that this is the they want to know about in this station. They want to know that hand hygiene, what to do and how to do. So that's I told her we do this way. So anyway,
Yeah, this is a very common scenario. It has come in multiple ways before. It came before with chicken pox exposure and a nephrotic syndrome. That's even worse, isn't it? A nephrotic being kept with a chicken pox. But at that time, the child didn't have the rash. So he was in the incubation period. So it's not exactly your fault completely. But still, I mean, we can say sorry instead of apology. We can say sorry for, I know this, but we did not know at that time he had the RSV infection. So, but yes, you're right. The hand hygiene should be maintained, and that part is correct. So maybe I don't know. I can only guess why the examiner cut the marks. But yeah, it can be tricky.
so
Sometimes the examiner. Yeah.
importantly, message here is that when you read the scenario there, if we have practiced enough, that also definitely it is important. It's very important
Yeah,
actually.
it gives you
Many of
confidence if
I knew
somebody.
that my communication is weaker, so we were doing every other case. I was telling some communication I have to do, so we were doing this something. And when you read the scenario there, uh, so start thinking that the what will be the need of this one, because the examiner will be just sitting and observing only. They will not, and as in the clinical station, they may prompt you, they may guide you. Sometimes they are helping and they may guide you. They can just drag you towards the actual case. But here they are just observing. So from the outside and from scenario only, you have to check what is required in this station. If all the things are not met with, they will not give you full marks. So that is important. Like in the my first this case, child with colic and the breastfeeding stopped and the soya milk is started. So all these three, four things had to be addressed. Similarly, in this case also, the this one, the angry mother, everything has to be like hand hygiene should be explained. and how is RSV is transmitted. That also to be explained like that. So then we have the managing the angry mother. That is also is there. The apology is important also. So on the
Yeah.
that's okay.
Yeah. So thanks a lot, Dr. Shabbir, for the feedback, and good luck for your future.
And thank you very much, especially kept on pushing, and especially that having this thing which I felt from before. Also, the reason I came to you once again to your course because uh, I I
Actually, I was feeling
believed like
really.
as if the cases which I will do with you, the some of the cases will come. So so
I know you even asked me in the previous attempt before you took my course. What are the cases? I said I can't guess like that. It's just during the practice, it happens. It's not under my control. And you can see and it was the last thing I did, and it came. Both we discussed the therapies, and we also discussed the same. I mean, it was so weird. Even I get surprised how come it comes in the exam, but I think it's from God. It's not me actually.
this is the like these short cases, the sickle cell we did. Respiratory chronic suppurative. It is quite common here. Quite chronic suppurative. I
Yeah.
think it will always if there is a respiratory case, it will be chronic suppurative lung disease. So similarly, this sickle or thalassemia also there, and thalassemia sometimes the thalassemia is very well managed. They don't have that typical features, facial features, and that.
Mm.
So uh, then, but it is quite common. There used to be more common before, but gradually because here the government has this one, the pre marital screening program is there in Oman. So gradually we are also seeing that the cases are reducing in the community.
Freezing. That's good. Mm.
So that we did also, and in the history, although we didn't do this case, but this was a simpler case actually. I think. Then this
Yeah.
one, the development, the same. The night before we revised once again, and couple of days before also. So that also came. Else, so clinical
Yeah.
three, clinical two. Cardiology actually was okay for me previously also. The cardiology I was not concerned that much, so just gone okay on the law. So cardiology station, the examiner said this time you will get through inshallah. But maybe he recognized me. Then in the communication, the last station also this one, the one with the colic and this thing. So he's after the end of the this one, he said good luck.